All right, so let's take a look at this case. We have a woman of childbearing age who's coming in with exertional dyspnea and has experienced recurrent episodes of pneumothorax. This history alone steers us towards certain lung pathologies, especially in young females. Let's explore the imaging to find more clues. Starting with the chest X-ray, we notice that the lungs appear to have large volume with some abnormal architecture. It almost mimics the pattern you'd see in emphysema with a more hyperinflated look. There are no obvious consolidations, but with this abnormal lung appearance, we need to think about potential underlying causes. This warrants further evaluation with a CT scan to get a clearer picture. Moving on to the CT scan, we see exactly what we're looking for. Numerous thin-walled cysts scattered throughout both lungs. These cysts are uniform and have a diffuse distribution. This finding is crucial, especially considering the patient's clinical background of recurrent pneumothorax and dyspnea. This brings us to the diagnosis of lymphangioliomyomatosis, or LAM. LAM is a rare lung disease marked by abnormal smooth muscle cell proliferation, which leads to the formation of these thin-walled cysts. It's most often seen in young females and commonly presents with complications like pneumothorax, which fits our patient's history perfectly, and sometimes chylous effusions. When considering cystic lung diseases, it's important to run through other possible diagnoses. For example, Langerhans cell histiocytosis, LCH, might present similarly in the lungs, but we'd expect upper lobe cysts with thicker, more irregular walls, and it's more common in young male smokers. Then there's emphysema, but in that case we would expect hyperinflation with different cystic characteristics. We also need to consider pneumocystis pneumonia, which can show cysts of varying size and wall thickness, though it's typically seen in immunocompromised patients. In this case, the uniform cysts, diffuse distribution, and the patient being a young female with recurrent pneumothorax all strongly point towards LAM. Thanks for sticking around for another case breakdown. If you enjoy these deep dives into radiology, make sure to subscribe to the Radiology Made Easy YouTube channel for more fascinating case studies. Stay curious, and I'll catch you next time.